come in to like support this kind of, healthcare workers? And do you see that, comparing from what you saw in a couple of years pre-COVID and now, how do you see technology evolving the way healthcare is going to be used? I mean, how patients will be able to access care. Your startup is patient care, right? And I love that, because the name actually sounds is resounding. So how do you think that pre-COVID and now, what has been the difference you've seen in terms of how technology is being used to, administer care to patients?
I can summarize it with one word before I give you like a whole story.
Okay.
Access. Access to healthcare has been much, much easier because now it costs you less to see a doctor or a healthcare professional with patient care, and also the healthcare professionals make more money. In fact, we thought that they would be making less. We thought our assumption was that these healthcare professionals, or the government job they have, or the private job they have, will be paying them much more than what they will be making out of our platform. But it turns out that they make much more. They make it about 30% more on our platform. So if you take their salary plus 30% of that, that's what they take home with patient care as a healthcare professional.
Mm.
And as for patients, we reduced the cost to see a doctor by 80% in Namibia. So what that means is you do not no longer need 500 rands or 600 rands or Namibian dollars. All you need is 150 Namibian dollars or rands, and you can now access a doctor. And anyone can get access. Anyone can reach 150. I mean, 150 is like it's for someone to tell you that they can't get 150 to see a doctor is quite impossible, actually. So we've made it accessible. And not only that, instead of you waiting in long queues or waiting in the clinic or going back to the clinic for 2, 3 days in a row, simply because you haven't been seen those previous days, on patient care you can be at your home, book a meeting, or even find a doctor online or a nurse or a pharmacist online, and within a few minutes you're well taken care of. The only downside we see with technology is the physical touch and your senses. So using those 5, 6 senses to actually see and diagnose a patient. And what we've done is we've brought in artificial intelligence, AI. However, we're not replacing doctors with AI. We're using it to make their lives easier. So we're using AI to gather data from the patient. So be it your symptoms, be it your history, be it your previous prescriptions and so on. The AI in our system just summarizes that for the doctor, basically. Whereas in the pre-COVID or before COVID, you wouldn't even have access to your personal file or your medical history unless you have a hospital card. So I think technology is making life a whole lot easy. And what we're trying to do is make it more accessible to everybody. It is a mission. It is quite difficult because the older generation don't really appreciate it so much. The older generation still wants to be going to the clinic and being seen and touched. But the millennials, the Gen Zs, the younger ones, our generation, they love it. They appreciate it. And I think technology is just here to help, not replace. Eh? And like we said before, there are nurses and healthcare workers, doctors that do not have jobs. I mean, USAID left the continent or left Namibia. Let me just speak of Namibia. A lot of a lot of healthcare professionals became unemployed. But now with patient care, we can still close that gap for them, and they can now treat patients and still have stable income. So again, I think technology is on point.